Hi, this is Dr. Antolak from theGentleDentist.com in Shelby Township, Michigan. 586-247-3500 is our phone number. And I am holding a model of some teeth. And what I wanted to do was to talk about the different types of fillings that are available that we currently do here at our office. The days of the silver mercury amalgam fillings are over. I have in place one of those on one of my patients here for the last probably 15 years. And the reason why is silver amalgam contains mercury, and mercury expands and contracts. And with that, we can find that there's some stress fractures in teeth. And a number of times that these teeth that have old fillings in them are cracked and they have micro fractures in them. And we often have patients who come in who break off part of their tooth from old amalgam fillings. Now they do work. They worked for over 100 years. It has been the choice. But now with the advent of technology, we use tooth-colored composite materials. And what I want to do today is just to discuss a little bit about that and how they work and why they work and what's all about that. So, because that is the majority of the type of material that we use for that. So first thing to do is after we numb you up adequately, we will remove the cavity that's in the tooth, and then we'll use what's called a bonding agent. That's this material right here in this purple bottle, and this little brush here, and we apply that right to the tooth surface. And then once we do that, then we have the ability then to use a material called composite resin. Composite resin is a plastic material, and what it does is it's pretty neat, because what it does is it gives us the ability to actually adapt the filling right directly to the tooth, and then what's hard, we then secure it and harden it up with our light. So, for example, with this material here, I'm just going to take a little piece off and then show you how this works. What we'll do is we can then apply that to if it's on a biting surface, we'll apply it to the biting surface here. If it's to the side of the tooth, we can then apply it to the side of the tooth. And so what we do is it's soft. As you can see, I can mold it around, I can move it around a bit. We can do this. We do this also when we bond front teeth too, but we can move it around however we want to. And once we have it in the position that we like, and we smooth it out as much as possible, then we use our curing light. This is a blue light that will actually harden with it. So I'm just going to go ahead and for just a moment, I'm going to just cure it. It just takes about a couple seconds to do so. And then what we'll notice is that on this model it's not going to actually stick, but what it will do is it will get so hard that you can see with this it's very hard. And now I can just actually remove it. And what we see now is that the material is very hard to the point where it literally crumbles if I have to push on it. And what we do is we harden up a little bit more with the light, and it becomes just about as hard as the natural tooth gets. So it's very hard. The beauty of the composite materials is that they're non-toxic. When there's mercury involved in a filling, that eventually can leach out, and the mercury vapors are the things that are dangerous, that get into our bloodstream and cause all kinds of different problems. Now, when I do it, I don't actually remove the fillings just to remove them. I do them if it's required to do so. Of course, unless somebody wants to come in and they say, hey, you know what, I want to have my silver fillings removed, then I'll go ahead and do that. We do that in a safe manner also, where we put a little device over the tooth, and so it really eliminates and reduces the amount of these mercury vapors that are emitted. Once that's done, we can choose the color of the composite material, that plastic material, depending on the shade of the person's teeth. We can blend it in. It has a chameleon effect, and it blends in really nicely. They last for years, they're strong. They've been working out for a long time, and in our hands there's no sensitivity with them, and they're very functional. So if this is the type of dentistry that you're looking for, one that is clean, current, you can give us a call at 586-247-3500. Thank you.